Hernia is basically defined as a uh, defect through which the inside contents come out. And if it is in the inguinal region, it is known as inguinal hernia. Basically, the testis or the gonadal ovaries in females, all of them develop in the near the back in intrauterine life. They travel in males into the scrotum at seventh month of intrauterine life, and they bring their blood supply and membranes along with it. So the region where it comes out through the abdominal wall into the scrotum is known as inguinal canal. So it has two openings. One is the deep ring and one is the superficial ring. So this hernias through these two defects are known as inguinal hernias. Hernias which we detect early in the life are known as congenital hernias. So congenital hernias, basically when the testis is coming to the scrotum, the membrane should get obliterated at birth. But if they are not getting obliterated, it leaves a defect in the deep inguinal ring through which the inside contents can come into the inguinal canal or up to the scrotum. So those are known as congenital hernias. Acquired hernias, which are acquired later in the life. So there are some risk factors, or you can say the causative factors, which can cause the hernias, acquired hernias. So this can be straining at passing urine or passing motion, or it can be a chronic cough. Inguinal hernias, as either it is direct or indirect. Direct hernias are the medial hernias or through the superficial inguinal ring, whereas indirect hernias are the lateral hernias, they are through the deep inguinal ring. Most common symptoms of inguinal hernia is the patient presents with the swelling in the groin region. So that swelling increases in size with exertion and reduces in size with the when the patient is resting or lying down. Or sometimes the swelling is persistent. It may be associated with other symptoms. It depends how the patient presents. If sometimes if the patient presents with the complications, then the patient may present with the symptoms of obstruction or strangulation uh, with irreducible hernias. The risk factors for hernias, if they are required, they are actually the straining. We should understand that inguinal canal is already there is a defect. We have two rings, deep and superficial ring. So it's a potential area for the hernia development. If some patient is straining continuously, either he has a chronic cough or he has constipation or he has enlarged prostate, that may lead to, those all are the risk factors for developing inguinal hernia. Inguinal hernia is treated surgically only. Uh, there are two methods we do it. One is open method, where we strengthen the posterior wall of inguinal canal from the above, whereas in laparoscopic repair, the second one, we strengthen the posterior wall of inguinal canal from behind, and we use mesh to strengthen the uh, posterior wall of inguinal canal. No, inguinal hernias are treated surgically only. But the if I give you analogy, if you have a hole in your pocket, it needs to be stitched only. There is no other way. So it's a physical defect. We need to deal it surgically only. So it depends on the presentation, as we discussed earlier. So if the hernia is complicated, the most common complications are obstruction and strangulation. We need to go in, do the hernia, means first deal with the complication immediately. But if it is uncomplicated hernia, it can be dealt on elective basis. Basically, hernia is repaired to prevent these two complications only. Yeah, the chances of recurrence is always there. So that is why we always treat the cause first, then the hernia. So the chances of recurrence is almost similar in both the repairs, open and laparoscopic, and it is close to even less than 2%. So basically, you are asking how to prevent the recurrence. So recurrence can be prevented if we treat the cause first. I'll explain this by giving example. If we have a patient who has hernia on the both the sides, right and left, and he has urination issues, and he has an enlarged prostate, then we should deal with the prostate first, followed by the hernia. The chances of recurrence will definitely be less. Basically, in today's era, if we are doing laparoscopic as well as open repair, we don't have too many do's and don'ts. Next day onwards, we ask the person to be normal, but definitely we advise the patient to not to lift heavy weights or to do strenuous physical activities, which involves abdominal muscles over a month and a half to 2 months.